All right, it's good to see you. It's my pleasure to take you through this presentation. We'll make it interactive, and I will also ask you to drop questions and in the chat room, and also even unmuted, we can discuss as we move on. So I'm looking at this subject, how to manage your mental health. What I will do is take you through a few things here and basically, have the discussion going. So this is the journey that we will take. The issue is about the fact that for many of us, mental health issues are things that in general we don't discuss. And so when I look at why I talk about mental health to carers, there are a number of things that come to mind. And perhaps it might be great as we start to even ask this question: why should we even discuss about mental health? If we can actually make a discussion on this, it would be great. Let me just hear your thoughts. You can unmute and we can just have a conversation. Why do you think we can talk about mental health? Tendai confirm people can speak. Hey, we have allowed people to speak. If you can confirm that their mics they can unmute their mics. I think it is, yeah. So, friends, any quick thoughts? Why should we be talk about mental health? Anyone? Why should we talk about mental health for carers? Any thoughts? Yes, please go ahead. I see there is a hand that is raised there.
Hi, good evening to everyone. I'm a carer myself, and I believe that since we too take care of other people in all different sectors in healthcare, but then the question is, who takes care of the caregiver? Because we have our own struggles as individuals, and then we still have the pressures from work. And who do you then speak to? Because sometimes when you try to speak to people at work or seniors or people in charge, they don't hear you. And then again, there's stigma as well. So people are scared to talk. So people end up bottling things up. You go home, you can't talk to people at home. And then you go to work, you can't talk to people. Everyone is just busy, or people are choosing not to listen. So the question remains is, that I always ask myself is, who takes care of the caregiver? Yeah. Because maybe if I just go off a bit, like even, like let's say people work in mental health, there is abuse to caregivers as well. In as much there is abuse, everyone is worried about the abuse being given to people we care for. But yeah, caregivers do get slapped, do get teeth thrown at them. They could get spitted at. Who takes care of them? Who speaks for them? Who's the voice for the caregiver?
Yeah, I like that. Thank you for that. That's a very powerful response to the question there. Let me hear the thoughts of others. Why should we even talk about mental health to carers, to caregivers? Thank you for that. I like that. Someone else? Yes, please go ahead. Someone with the Samsung there.
Okay, mental health, it's safeguarding your mental health, your brains, your thinking, how to react to situations. I'm a carer, by the way. So I think mental health is safeguarding yourself from dealing already, you are a carer, you care for someone. So while you are caring for someone, you should also be in a position to look after yourself. As much as you are looking after them, the clients, you must also look after yourself mentally, the way it affects your mental, your thinking capacity, or how to cope in a situation. Yeah, I think it's basically safeguarding your mental health.
I like that. Thank you very much. Maybe let's have two more. Let me just hear what other people think as well. Let me have two more contributions. Why should we even talk about mental health to carers? Very good responses. Please go ahead. All right, maybe I think that's fine. So I just want you to know, friends, because we do quite a lot of work with carers. The reason why is a good subject, why we should actually talk about mental health issues is generally because of, you know, a number of things that, you know, we as carers will face. So those things, I'm glad we have indicated there are quite a number of challenges that we face as carers. Then in addition to these challenges, there's also a lot of misunderstanding regarding mental health issues. You know, it's interesting that there is some belief that we can still continue to function without, you know, looking after our mental health. It doesn't work. Eventually, we get to a place where we will collapse. And so people don't realize that mental illnesses are actually quite common, even more common than cancer, diabetes, or even heart disease. This is how common mental health issues are. And it is also, you know, a matter of fact that while women are more likely to have a mental illness than men, men actually commit suicide 5 times more than women. And yet this, you know, some of the research is made indicate that by 2029, mental illnesses are actually predicted to become the leading cause of disease worldwide. And that is, you know, looking at World Health Organization. So it's no longer, I hear this, a luxury, if I may put it like that, for us to talk about or not to talk about mental health issues. It's actually becoming a necessity because, like what I normally say to people, the reality of some of these things is that if we ignore them, the said reality is we can't ignore the consequences of ignoring these things. So we can ignore the importance of mental health issues or discussions around mental health, but we cannot ignore the consequences of ignoring discussions around mental health. And so that is something that is very important for us to take note of. So it's a subject that is becoming very important for us to be able to discuss, and it is a subject that requires all of us to have an understanding of it in a way. So that's why it is important for us to talk about it. So I would just briefly just indicate to us, you know, what mental health is. And then what I want us to do is go straight into discussing, you know, how to handle, you know, your mental health issues as a caregiver. So it's important for us to take note of the fact that when it comes to mental health, again, let me share the screen. I'll just be in and out of the presentation here just on purpose so that I can go to important aspects. There are quite a number of things that I want to share with you, so I won't follow everything that is on the presentation here. But so let me look at what mental health is. So according to WHO, this is what mental health is. They say it is actually a state of well-being in which one can, realize his or her own abilities, can cope with the normal stresses of life, and can work productively, and is able to make a contribution to his or her community. So that is actually what mental health is. And what's interesting, friends, is this mental health is actually on a spectrum. And I want to just put this spectrum for you to take note of. So just like physical health, which is actually on a spectrum. So we are not here this 100% always physically well. We are not. You will notice that you will become 100% physically well. You will also become maybe 50% well. You can become, 5% well. And if you get to 0%, obviously, you will die. The reality is when it comes to mental health also, it's on a continuum. And this is something that is very important for all of us to take note, that our mental health does not stay the same. It will move from healthy, normal functioning in the green there. And it will also, here this can get to when one is actually ill and you are suffering from a clinical disorder. So there is that possibility. The third thing is this, as carers, because carers were actually even prone to, become reactionary, to be injured, and to become ill because of the nature of the challenges that we face. The third thing is this: many of us may not actually realize that there is need for us to be able to look at our mental health issues. And here, this is very important for us to actually get checked for mental health. In terms of, our physical health, medical doctors, they tell us that you should go and have a medical checkup at least once, a year. For dental therapy, they recommend twice a year. The reality is this: we are also recommended to actually at least go also to have your mental health checked, at least once a year. And you don't have necessarily to go, for a mental health checkup because you're actually feeling ill. Not necessarily. Sometimes it's just good for you to go and check because we all have blind spots. We may not even understand that we are getting to a place where we are reacting or injured and becoming clinically, having a challenge when it comes to mental health issues. So it's important for us to go for a, mental health checkup. And so that's very important, more so if we are caregivers. Let me pause there and just check if there is any comment with regards to this, your thoughts in terms of the necessity or the need for you to go for a mental health checkup. Let me hear your comments. What do you think about that? Does it make sense? Is that something that we do, or we actually feel maybe that is something that may not be necessary? Let me hear your thoughts. Feel free to, just unmute or to just raise a hand. Maybe raise your hand. It's better. Any thoughts? Please go ahead. Thank you.
Hello.
Yes, please go ahead.
Well, that's my personal thought that so many people would struggle with actually accepting that they need help. One being because of the way we're brought up, our backgrounds. Well, I'll speak for myself. I come from Zimbabwe, I'm African, and most African people, not only from Zimbabwe, the way we are brought up to bottle in our feelings. There's mental health is not a thing. Once something does not have a label, it's difficult to deal with. So from childhood, you would bottle things up, wouldn't just filter things. We grew up knowing you have to think before you talk, because of the consequences. And then being adults as well, it's different now that we are in this first world where people can now express, but it's not everyone who has gotten to that point where they know that it's okay to talk about your feelings. It's okay to break down. It's okay not to be well. It's okay to cry when you feel like crying. I think maybe the first thing that maybe caregivers might need to have is to be taught to be able to talk about their feelings. Because in this job that we do, it's all about masking. It's different when you work in an office 9 to 5. You can just say to people, do you know what, today I don't feel like talking. I'm just going to work in that corner quietly. But with us, you can't. You have to smile, you have to laugh, you have to, even if you don't feel like it. So you kind of like, you have to mask your own feelings. You need to forget yourself, and just imagine you're working a 14-hour shift. Well, talking for those who do domestic, how many doors do you have to knock? You have to be smiling every time. Yet inside you're dying, you're breaking, and you can't cry because you've got somebody else you're working with. Then you go on your break for 1 hour. You've got someone with you. So there's not that time for yourself. When you finish 14-hour shift, you have to go back, go home. They drop you by your door. So me, for example, I like working far away from home because I need that time for myself. I need that. I drive like an hour. People think I'm crazy, but I'm not. That 1 hour, I get to play my own music. I get to do my praise and worship. It's all about me before I go home, So anyway, without saying a lot, so it's just about educating people that it's okay to talk about their emotions, and people need to find their own coping mechanisms as individuals, and then it's okay to go and speak to a stranger. It's even better to speak to a stranger because they won't judge you, they don't know you. And if you don't feel comfortable, you don't have to go back there. So that's what I think.
Yeah, well done, and I think it's a valid input there. That the reality of our background is that we grew up, for some of us, being told emotions are not important, and ukatochema ukarohwa ukachema unonzi inyarara ukatochema futi ndotokuwedzera. So we were never meant to actually be in touch with our emotions, and so that's a fact. Anyone else? Any comment?
Good evening. My name is Bukola.
Good evening. Please go ahead.
Yeah, I think I worked as a carer and now I manage carers.
Yeah.
And my opinion is that some of us we don't recognize it. How do we recognize our stress? We just know we're stressed, we're tired, we're this, we're that, and then we go home and we sleep. But then deep down, we're suffering. So I think
you've muted yourself.
Oh, I'm so sorry. Yeah.
Go ahead. Yeah.
How do we recognize these symptoms of being stressed? How do we know that it's time you need to talk to somebody? How do you know that it's time that you need to take it easy? Because a lot of us we don't recognize it. I know we talk about we keeping our feelings and not talking and not doing all those things. Yes, I agree with that. But how do I know I'm doing that? A lot of times you are doing it, you don't even know. So what are those things that you say in yourself that you know that okay, now this is a breaking point. You need to say somebody.
All right. I like that. Thank you. I will comment on that. Naomi, please go ahead.
My name is Naomi. I just wanted to ask,
Mhm.
because I'm thinking if I am to go and seek for mental support or mental health, then automatically I'm disqualified to work in the adult social care service. Is it true, or it's just me who is just thinking it's wrong?
Wow, I think that's an interesting one. You know, there are certain things that are myths. I probably haven't come across that to say if you fall ill, because it's just like if you fall physically ill, then you should be qualified. You should be disqualified from working because being emotionally or mentally ill does not necessarily mean, you know, there is that confusion that mental illness means you are actually schizo or penga. That's not it.
Okay.
So why should you be, you know, disqualified from working because you know, mentally ill? Because every one of us will become, you know, at some point in time, mentally ill. That one is a fact. So I haven't heard that, unless if there's someone on the platform who has heard that or who has encountered that. Because sometimes many of the things that we actually, you know, carry as facts are probably myths that we have heard from other people. But I doubt if that is true.
Okay,
Just
no,
to,
that's fine.
just to add a little bit on that, you will notice that another way of putting across the mental health continuum is like this, that at some point in time, you will notice that in terms of disturbance level, you may be disturbed. So if your disturbance level is 0 there, you are not disturbed from a mental health perspective, you have, you know, total sanity here. And then the disturbance level can actually become 10%, 20%, and can become 100%. When it becomes 100%, then there is complete insanity. And so this is actually a reality in terms of mental health. So what is very important, which I want us to just quickly look at, is how to handle your mental health as a carer. And this is something that is very important, and I just want all of us here to take note of this. My view is there are 3 things that are very important for us to take note of. Number 1 is prevention, and number 2 is therapy, and number 3 is rehabilitation. I've just put the slash spiritual. So 3 very important things that we need to take note of. And I want you to take note of this, you know, because some of these things, I normally say to people, the knockout punch in life is the one that you do not see coming. That's a knockout punch. And like what I also mentioned earlier on, someone said that if, you know, you ignore, some of these things, because you can ignore some of these things, you will still hear this, suffer the consequences of the ignorance that we have. You will suffer the consequences. So prevention is for those not yet having mental health issues. So some of us, you can be on this platform and say, well, you know what, for some of us, we don't have mental health issues. We are cool. We are great. Hear this, you need to take note of the fact that there's need for you to actually go for prevention. Then other people may actually be suffering, you know, feeling a lot of, signs, and I'll talk a little bit about some of the symptoms or signs that may show that you could be having mental health issues. So for those, you need to go for therapy. And then rehabilitation are for those who, in terms of disturbance level, if we're looking at that, maybe over 50%, then you actually probably need for rehabilitation. So when disturbance level is low, go for preventative. Then there's mild treatment, then moderate treatment there, and intensive treatment. That's what we are looking at. So let me begin with the first issue, that is necessary prevention. So somebody mentioned in terms of prevention to say, okay, so should we actually learn about mental health issues? That's probably the way I'm just paraphrasing the statement there, which they mentioned that sometimes we don't even know about the signs that we probably could be suffering from mental health issues. What it simply means is this, and this is important for all of us who are here as caregivers. So I normally say to people, it's very important that when you are doing some kind of work or profession, whatever profession that you are doing, learn as of importance, learn the risks and learn the challenges that most likely you will face in that profession. So that is something that is very important. For example, like what we mentioned earlier on, because this will actually help you to prevent. So if you know that, for example, as a carer, most likely you will work with people who have, some challenges. The working conditions may not necessarily be that good because of the nature of work. And by not that good, I'm just saying that the reality is some of the people that we will look after may have their own issues. They may actually even have their own mental health issues. Some of them, they attack you. Some of them may, exploit you. You can actually have, for example, if we're carers, for many of us who come to the UK, we come without our families. So there's family separation. You come here, and sometimes, even if you are now together, your spouse is, coming into home when you're going out because of the need to be able to make ends meet, which is normal. So there is debt pressure. You can have cases of revoking of licenses. You can have, sadly, racism sometimes. So there are so many challenges. Here, this prevention means that start by understanding the potential challenges that you will face in the caring work. It's something that is very important, that we study, we understand, what we will face. But that will actually help you in terms of what are some of the things that I may need to do. So understand the challenges. And then here this desire to, as part of prevention, desire also to understand something about mental health. Because let me tell you, friends, self-care is not selfishness. Self-care is not selfishness. And as long as you are not looking after yourself, if you don't prevent your collapsing, if you don't prevent your collapsing, the reality is this: you will not be able to look after, your employment, and here this your dependents if you are not well. So you must, study about, the potential challenges from a mental health perspective. You study that. That is something that is very important. And yet this also expose yourself to potential solutions. So it's not just about the challenges only that you should be aware of. As part of prevention, expose yourself to potential solutions, that can actually help you to deal with mental health issues. And the solutions, some of them are things that, are not necessarily too difficult for you to do. For example, issues to do with thinking about building support systems as you are, coming to work. For example, what support systems can we build? And one of the things that I do encourage people, it's certainly what I've discovered is sometimes we can, be interestingly divisive in our approach towards life, where we don't want actually to come and unite and build support systems, and we become individualistic in nature. And it's just interesting how sometimes we, as a community of carers, for example, we cannot actually coordinate ourselves and come together and build support systems. Because amongst us, for example, if someone does not have the capacity to look after their children because they've just come into the system and they need help, can we, cover each other as a community? I remember I was talking to my young brother a couple of months when I was in the UK there, and we were commenting about one group of people who made sure that when they are, guys come from, countries, from their home countries, they would actually arrange for, childcare and so forth to ensure that the people are not burdened as they come. And it's possible for such kind of things to be done to ensure that there is prevention of a situation that can actually make people to collapse. So such kind of support systems are important. Things like understanding immigration rules are things that are actually very important, in terms of not getting ourselves to a stage where we now have to fight the law. Because now when you begin to fight the law, it becomes an issue for you. You will feel the challenges. Talk about self-care culture, talk about open communication, and even discuss in terms of the need for you to cry out for help, to give yourself permission to say, you know what, when I feel I'm not coping, I can actually cry out to others for help. So these things all are things that can be part of prevention, so that we don't get to a place where we can find ourselves deteriorating in terms of our mental health issues. So prevention is something that is actually very important for us to think about. That's why, this old adage is always there that prevention is much better than cure. It is much better. It is the cheapest. The money that you can actually put towards even getting information, towards getting advice, and before you deteriorate from a mental health perspective, the money that you can actually use to go for a mental health checkup, for example, is actually far less, and the consequences of doing that are less than when you are actually now at a stage where circumstances are forcing you to go and seek for help. So prevention, out of the three recommendations here that I have, it is actually the least expensive of the three, and yet here it is the most powerful, because you would rather be at a place where you are not mentally unwell. So prevention is something that is very important. So that is the first thing that I want to just mention. Prevention is actually much better than cure. Let me have your comments, because the reality, friends, is this: we cannot afford to stay ignorant when it comes to mental health issues and how to look after ourselves. So you do yourself a great favor to say, how can I prevent myself from actually deteriorating? It is a favor that you should do for yourself. And hear this, I want you to take note of this: self-care is never someone's responsibility. It is your responsibility. Your comments. So we start here this at prevention. And many battles will be won when you do a good job in terms of prevention. Many people, unfortunately, even when they are, coming to the UK and so forth, they don't do a good job in terms of, looking at potential risks around mental health issues when you are looking at the profession which they are doing. Let me hear your thoughts. What are we hearing? Let's feel free to speak, because it's important for us to have these discussions.
Excuse me, Dr. Justice. So there are other people who are typing in the chat, so you can also check.
Yeah, please go ahead. You can read them. That's fine. Please go ahead. Read the comments. Tendai, can you read?
Okay, there are questions that came earlier on, so maybe we can address them at the end.
That's fine.
Okay.
But are there any comments that I can address the questions at the end? Maybe let me quickly rush them so that I can get an opportunity to address the comments. So the first thing here is this, friends, if you are to take care of your mental health as a carer, let me tell you, prevention is something that you must actually consider as a focus area. It's very important. The second thing is therapy. And so we mentioned that therapy is when you feel you probably are not doing as well. And I noticed that there was a comment where somebody said, yeah, but I probably do not know the signs. So I just want to put the signs here for us to look at. And these are signs that are important. We normally talk about what is known as the 5 Ds. So the 5 Ds, number one, is where there is deviance in your behavior. So these are behaviors and emotions that are viewed as unacceptable. So it could be deviance from social norms, where a social norm is an unwritten rule about acceptable behavior. So if you see some form of deviance, then you may want to check, you know what is happening here? And sometimes one thing that we encourage people is for you as an individual to always give permission to people to speak to you. Some of us, we actually think that no one has a right to speak to us. Let me tell you, in life, the reality is we will all have blind spots. So have people who, are allowed, by you to actually come and speak to you, because deviance, you can actually have deviant behavior, which you are not actually noticing. The second thing is dysfunction. This is when, an abnormal behavior is significantly interfering with everyday tasks and, the way you actually live your life. And again, when you feel, I'm no longer functioning very well, maybe I'm now becoming too tired, I'm, not doing work the way I used to do it and so forth, and you are feeling like you don't want to work and the like, then you can actually say, maybe I need to go and, talk to a therapist. Distress is another one. When the behavior is causing the individual distress, and distress means a feeling of extreme worry, sadness, or pain. And when you are feeling that, I don't seem to be seeing, that I'm behaving the way that I should normally, or I would normally behave, you could actually be distressed. And again, it could be an indicator that you need to go and talk to somebody. The danger is another one, when the behavior harms or puts at risk the individual or others around them. So you can now become a danger, hear this, to yourself or to other people. Again, this can be a telltale sign that you may need to go and talk to somebody. And finally, duration. So the therapists will be able to tell you when the duration of all these deviance, dysfunction, distress, and danger is beyond, say, 2 weeks or 3 weeks or 1 month or sometimes 6 weeks. Then there could be a possibility that there is a certain challenge that you're facing. So in general, therapy is something that is very important. Unfortunately, for many of us, our background and the cultures where we are coming from, we feel that if we go and tell other people that, you know what, I'm not coping, I'm stressed and the like, we feel that it actually shows we are not doing, we're not strong, we're not bold. And hear this, that is actually a lie from the pits of hell, as I would put it across. Every one of us at some point in time, hear this, we can actually encounter something that we call a crisis, something that can overwhelm us, and we need to talk to others. And finally, the third thing in terms of taking care of yourself is rehabilitation. Some of us may actually need to go for rehabilitation. And when we get here in terms of rehabilitation, then sometimes the challenges or the issues around rehabilitation become a serious thing because the costs are high. And here this, even if you need rehabilitation, sometimes you're at a place where you do not want it, although you actually need it. And then there is serious disruption to family activities. And rehabilitation is the most expensive of the three issues that we are talking about here. Rehabilitation is the most expensive. But here, what I want you to take note of is this. If you actually don't prevent yourself from having serious mental health issues, if you don't work on, a therapy route, if you don't work on having a therapy route, eventually here, something can happen that will cause you get a place where you may need rehabilitation when you are not functioning well. And we've seen people actually deteriorating because some of the problems that people have or mental health issues, they actually become worse when they are not treated. So three recommendations in terms of handling your mental health, as a carer. Number one, prevention. Number two, therapy. And the third one is rehabilitation. Please go ahead and read the questions. And we can also take other questions as we draw close to an end of our presentation. Let's talk.
Yeah, the first question goes, where do we go for checkup?
That's very good. In terms of mental health issues, what is very important is for you to, use, registered therapists. I think it's if you just check in the directories, you'll be able to find information about that. I think the NHS system also offers, some solution to that as well in terms of checkup. The only challenge, though, obviously, is sometimes the waiting list and so forth can be a challenge for people. There are, for us, we support quite a lot of people from here, from Zimbabwe. We are registered psychologists, registered counselors, and so we're working with quite a lot of people in the diaspora. We work with people from all over, in the States, in Canada, South Africa, UK, and so forth. So again, it's an option that you can use. What I've discovered is this: for many people, they think that therapy or even just finding information on prevention is expensive, and yet it is actually the least expensive, because when you get to the stage where you now need like I mentioned, rehabilitation, you're at a place where it becomes difficult for you. It's much, much more expensive. All right. Second question, you said there were some questions there. Any other question?
Someone asked, how do we differentiate mental health from stress or reaching a breaking point?
Okay. How do you differentiate mental health, stress, and reaching a break. So the reality is mental health, like what I mentioned, it's on a continuum. So stress can actually be part of mental health issues. So there's always what is known as, when it comes to stress, you will face normal stresses of life, and you are still able to cope. That one is okay, because we all need actually stress in life, and we call it healthy stress. So there is healthy stress, and then there is unhealthy stress. Unhealthy stress is the one that this gets you to a breaking point. Okay. The worst thing is for you to get to a place where you are, now at a breaking point, and you can't cope. And when you can't cope and think you can cope, you're actually probably not doing justice to yourself and to your family, because you can collapse. So we should stop trying to be heroes and allow somebody to actually, talk to you about that. When you feel you are not able, even I normally say to people, even when you just feel stressed, just go and talk to someone and say, hey, and talk to a professional. Just allow somebody to look at you, at your situation, and say, hey, tell me whether this is actually normal stress of life, or I'm actually at breaking point. You don't have to be a hero.
Okay.
There are Ruby, and I think there's also the other hand from a Zoom user. Any of you guys, go ahead.
Hello, good evening. Hello, Doc.
Hi, how are you?
Good. Yeah, I just wanted to jump in as well, just to say that there's help available from your GP. So for people who are asking where to get help, the first place to always go to is the GP. It may be difficult. I mean, most GPs, you can get an appointment pretty quickly. And then you can also self-refer to the NHS talking therapy. And it's on the NHS website. So always make use of the NHS website, make use of the resources that are there. So even if you just Google mental health support NHS, there's a lot of support that's available. You can even refer yourself. There's Mind, which is almost in every town. So Mind also has quite a lot of resources and information. And then private therapists, if when you need therapy and you need it quickly, and you need to have maybe therapy that is also culturally sensitive or appropriate to your culture, or to speak to someone who understands your background or in a language that you understand. Doc has shared their contacts as well, and we make a lot of referrals to their team, and they've been so helpful for so many people. So there's a lot of resources that are available for you. And I think there's a question that just came up, which I just wanted to also touch on, which is about SADS, which is the seasonal affective disorder. And it's a type of depression that comes and goes in seasons, because when it's winter, it's so depressing. It's just depressing because it gets dark at 3 and then it's only light at 7. So sometimes you never even see the sun. You don't even see daylight because you leave home at 6 and come back at 10 at night. So sometimes you start feeling really very, very, very depressed in winter, and you just feel sad. That's why it's called SAD, a seasonal affective disorder. And you just lose pleasure in anything. You feel so a sense of despair, and eating a lot. You end up eating to comfort yourself. You gain weight. You then get into a cycle, and it's really a thing that affects a lot of people in the UK because of the weather. And it's so important to see your GP. If you think you've got that, get help. It's not normal. And it can be really overwhelming to feel that way. I mean, it happens frequently, but you don't have to stay in that place. You can just get help to try and see how to deal with it. There's even lights you can use. There's certain things that can help you. So it is something that affects a lot of people.
And thank you, Rumbi, for that. So the starting point always, and I like what you said, the starting point when it comes to health issues is always your GP. So please ensure that you use your GP. That one is something that is important. for you to take note of?
Okay, there's another hand from Zoom user.
Go ahead.
Oh, sorry, my name is not written.
Yeah.
I didn't realize it. My name is Vanessa. Yes, when you speak about where do we have to go, and you mentioning GPs, every time you go to the GP, I mean, I take it to a doctor, the minute you start talking to them, they start typing on the computer. So for me, I'm thinking, hello, who gets to see this? Tomorrow I might need to do something, or maybe, for example, want to be a provider for mental health. And then there's a report of me, being mental unstable or stressed, So isn't there a place where you can just go and speak anonymously? No one gets to know who you are, but you still manage to get help. Is there a place like that?
Yeah, I think it's a good one. The reality, I was talking to a medical doctor, a friend, and they were saying that one of the things that many patients don't seem to understand is their right to be able to actually talk to a doctor and ask for attention. So, and they say that sometimes we actually don't know our rights. So I just want to encourage you, when you go to a doctor, you have a right to actually ask questions. It's something that I want to just put across. But is there a place where we can actually go and have anonymous counseling and so forth? I maybe Rumbi, I don't know if you know of places like that, but I think they should be there if you look around. Maybe some CICs can offer that service if maybe they're funded to do that. If you look around for them, you can find them. But obviously, there are some private players who offer counseling or therapy, psychotherapy, and so forth. From a professional perspective, if you choose to go there, there are always some ground rules and ethical issues when it comes to therapy, where if you're not satisfied with the service, you can actually raise a complaint. That one is actually something that is available. Rumbi, you want to comment on that?
I was just going to say, I hope that we can try as much as we can to debunk that myth that you've said, Doc, about sometimes there's so many myths about, so the doctors will record everything. Your medical records are recorded. But if you've had depression, or if you've had a period of anxiety, or if you've had a period of low mood and you've gone to the doctor, and even if you've been diagnosed with mental illness, that is not a reason for you to be disqualified from doing everything from doing anything.
Yeah,
when you're
definitely.
well and you're healed. And it's a stigma that's attached to mental health, and that stigma is ingrained in us, I think. So when we talk about anything to do with our mental well-being, we then think, I'll be judged, I'll be excluded, I'll be discriminated against. But that is a stigma, and it's a myth. And so your GP has to write, because they have to record their notes, and so they're accountable to the CQC. They have to keep records. It's all about the record keeping. But if you don't feel comfortable, then as Doc said, you can always go private. You can self-refer to talking therapies and tell them that you want to remain anonymous, that you don't want to talk to anyone to record your details. You can also talk to the Samaritans. If you're feeling suicidal, you can phone them 24/7. You don't have to tell your name. So there's a lot of charities, there's a lot of organizations who offer 24/7 helplines where you can phone. There's online chat rooms where you can which are safe, where you can get help for mental health, when you're going through just a crisis. But please don't be afraid of the GPs, because it is services that are available to you.
Yeah. So, and thank you for that. So I think the major challenge that I've also seen in working with a lot of people is that sometimes people do come to you for help, but sometimes they present late. You will notice that most of the challenges that doctors do have when it comes to even just physical health is late presentation of cases. So if it is cancer, someone is presenting when cancer is in stage 3 and so forth. So the issue is this: let's not be afraid of seeking help from professionals. And some of the things that we have been told by others, these issues of saying that you will be disqualified to do certain kinds of work, etc., etc. Yes, probably maybe when it comes to maybe jobs like pilot and the like, where your medical health is probably the rigorous issues that they look at. Maybe we can say, maybe there can be an issue. But in reality, most jobs, you will not be penalized for having had an episode of mental health issues. Sometimes we just have these myths and we need to debunk them so that we are able to move forward. That's why I normally encourage people to seek the services of professionals for you to be able to know the way forward. Because sometimes we actually then present late to the professionals, and by that time, whatever issue that we are having, they are komba. Someone else? Another question, if it's there. We have 7 minutes to go. Well done, guys. I'm impressed with the comments, the discussions. Well done. Let's keep this going. Are there any comments on the chat or questions?
There's someone called Mambira. They're raising their hand.
Please go ahead.
Good evening, everyone. I don't know whether you can hear me.
We can, yes. Please go ahead.
Okay. I would just like to emphasize regarding seeking support for mental health. I understand that sometimes it can be very difficult for fear of being judged and everything else that everyone has said. But to say that in terms of confidentiality, sometimes these services, if they have assessed you and they feel that you are at crisis point, they may have further discussions with you with regards to having your details in order for them to check on you. So they will go through a checklist of several things in terms of your personal safety, personal harm. In that I'm mentioning about, are you having any suicidal thoughts? Are you wanting to self-harm or ending your life? So sometimes we need to understand that we have to give them our personal details. And anyway, when you do make a self-referral, you will put obviously your phone number, your name, your surname, and that's how then they may be able to access your records. There is no shame in that. And I think it's a starting point for us to realize that sometimes it's not about and that, but it's prioritizing that I need this help, and this help in order for me to function and to be good, for my family, friends, clients that I'm working with. I need to seek this help. So some organizations like Samaritans, if one goes on their website, if you don't want to speak with someone, you can write an email, you can write a letter, or if you have a smartphone, which most of us do, we can download the smartphone's app that can help us. And mostly it's CBT, which gives us the skills to be able to realize what our feelings and our thoughts are impacting on us. And you're then provided with the skills to try and support you in improving your mental health. And to also emphasize that there is crisis support. So even if it's 1 a.m., it's 2 a.m., it's 3 a.m., the Samaritans, there's the NHS crisis that one can just give them a call, you talk with someone, they don't know who you are, if you feel comfortable that way. So let's just remember that there is that wraparound support that anyone and everyone can access.
Lovely. Like that. Thank you very much. So the reality, friends, as we close, is that don't be afraid to get help. Help is probably closer to you than you may actually realize. Remember, I mentioned there are three ways that are very important. Prevention is the best. Therapy is second, and rehabilitation is the third. And let's make use of these depending on where we are. And you know what? Be selfish when it comes to self-care, if I may put it like that. Self-care is something that is very important. So thank you guys for joining, and I enjoyed the discussion. I think we need to have more of these discussions around mental health issues, and there are many things that we can actually talk about. And please do join next time. Let me hand over back to Tulia here.
Thank you so much, Dr. Justice Marwisa. That was an insightful discussion that we had. And thank you everyone for joining us. I'm just going to go through some of the services that we provide at Tulia, which include legal advice on UK immigration, visa applications, appeals and administrative reviews, and so forth. So all this information, you can find it on our website. And you can also look at some of the services that you can get from Tulia by scanning that QR code on the screen. So we also have various groups. If you haven't joined any of our community WhatsApp groups, please do so by scanning this QR code on the screen. You can also volunteer to work with us at Tulia. You can also follow us on social media. And there's also a 6 a.m. prayer WhatsApp group that you can join. All of that information is on the QR code. Thank you everyone for joining us today. Maybe those that would like to leave, you're free to leave, but if you may want to stay a little bit more to
Tendai, before people leave, sorry to interrupt you. I just wanted to say thank you so much to Doc Justice. Before people go, just to say thank you so much for dedicating your time. I know it's late in Zimbabwe now. And thank you for all the support that you give to us in the diaspora all over the world. And we really appreciate you taking the time out to do this session with us, and all the support you give, direct help to many, many people that we constantly are referring and sending your way. So thank you so much. And that was really good. Thank you.